You and your provider form a very important partnership in your race against diabetes and heart disease complications. So it's really important that you're seeing them regularly and that you're, in good communication, that you're bringing your amount of effort to the game as well, and keeping track of the data. And then I always like to tell my patients, let me print you off a copy of these labs. I like for my patients to keep their own little record because, people move, things change. Our electronic record changed a few years ago, and that made things hard. So it's really good to keep track of this history, your history with diabetes, and to have a really good communication with your provider. And if you don't feel that this provider is communicating with you in a way you want to be communicated with, maybe you want to find somebody else. You want to be able to talk to them openly. And one of the other really important things is to let your provider know that you are not a diabetic. You're a person with diabetes. And this is part of our new language guidelines that we're now using to talk to people. So I try to remind people with diabetes is that, and I'm not a diabetic, I'm a person with diabetes. And so you'll see it in print. Once you start saying that inside your head and you hear people say something to you about, are you a diabetic? Say, no, I'm a person with diabetes. So correct them if they're using that kind of language. So one of the things that's really important is your provider really wants to know what's on your mind. And so you shouldn't feel nervous or concerned about asking questions. But the important thing is to keep track, keep a little piece of paper, write down the questions in the week or so before your appointment. As you think about the appointment, what are some of the things you want to ask? It's really important that you have it written down, because then when you get in there and they're talking about what they want to talk about, and then you forget to ask your questions. And if you have a provider who doesn't seem to want to hear your questions, maybe that's not the right provider for you. So, but it's important that you feel comfortable asking the questions that you have, and so that you're involved in the process. You're part of this partnership. So it's important to find out if you're at risk for cardiovascular disease, and you can start out by just asking your provider, am I at risk for cardiovascular disease? Well, just the fact that you have diabetes, the answer is already yes. But you want to know, what are my specifically, where am I at highest risk? Are my lipids too high, my cholesterol? Is my A1C too high? What should it be? How's my blood pressure doing? Should I be on a statin to lower my cholesterol? Some people like for their people with diabetes to be on a little bit of blood pressure medication to reduce their risk of renal failure. So there's all kinds of things that can be done for prevention. And it's important for you to ask the questions. And you know what that does for the provider? It gives them that warm feeling, this patient's really interested. They really like to hear that somebody's interested and wants to know and cares about staying healthy. So don't be reluctant to ask those questions. Yeah, there's a lot of great resources out there that you might want to look into. The Association for Diabetes Care and Education Specialists website, ADCES, has lots of great resources for patients, as well as the American Diabetes Association has a lot of good information that would help, I'm sure. If you're looking at resources, what could help me with weight loss, diet? Weight Watchers has a website, Noom. Both of those have a fee attached, but They're both really good references. And then to kind of keep track of how things are going, MyFitnessPal is free, and it's really great for tracking the foods you're eating, your exercise, your steps, things like that. And I have a lot of patients who do really well with that one as well. So you're thinking, well, what is a diabetes care and education specialist? Well, we're healthcare professionals, nurses, dietitians, exercise specialists, who have gone through a rigorous preparation and certification, and to educate people and help them with their diabetes management. You may have heard in the past about CDEs, those Certified Diabetes Educator. Well, we kind of grew up and expanded our title and our activities. So now you'll hear them is the CDCES and Diabetes Care and Education Specialist. You also may see some people, or like your nurse practitioner or your PA, that have initials behind their name, BCADM. And that's a certification for advanced practice clinicians, and it's the board certified in advanced diabetes management. Why do you need these people to have these special initials? Well, it means that they've got special preparation in diabetes care and all the intricacies and the complexities of managing diabetes. So you may want to look or talk to your provider about, can you refer me to a diabetes care and education specialist or a diabetes education program in your area? You can find diabetes care and education programs by going onto the website, the Diabetes Care and Education Specialist website, and they have lists of certified programs that have been specially certified as good education programs. I think the American Diabetes Association would also be a resource for finding recognized programs to provide diabetes care and education. So let's talk about getting ready for your next appointment. So the first thing you want to do is look at, do I have enough data? Have I been checking? So you may want to, for the next few weeks, check your blood glucose levels more often and keep track. And maybe if you do see a level that's higher than, it's like your after dinner blood sugar was like 200, make a note what it was that you had to eat that caused that. So get all that together, jot down the questions that you have, find out what labs you've had, remember to ask about the results of the lab work you've had recently. And then talk to your provider about what do I need to be doing to reduce my risk of cardiovascular disease and diabetes complications. Is there anything special that I need to do? Consider bringing your spouse or partner with you to the appointment if that's allowed. It's usually helpful to have a support system with you on your appointment. Good luck.